Pascale Carayon, I've mentioned the name several times. She plays a critical role in this whole area. She's a Leon and Elizabeth Janssen Professor at the College of Engineering, University of Wisconsin-Madison, and she will take over and talk about shift in our mental model, the systems approach to clinician well-being. Pascale.
Thank you very much, Dr. Zhao. If a technical person would allow me to share my screen, then I can get started with my presentation. Thank you very much. There you go. Great. Thank you. As Dr. Zhao indicated, the COVID-19 pandemic has really unveiled many challenges and risks that healthcare workers are facing, including, of course, infections, psychological and emotional disturbances, illness, and even death. During the early phase of the pandemic, citizens around the world actually discovered or rediscovered their healthcare workers and the ability of those healthcare workers to deliver amazing care in critical situations. But working under such stressful conditions is just not sustainable. So we need to renew our commitment to address clinician burnout and figure out better ways of improving clinician well-being. We just cannot continue with the same model and old assumptions. So we really need a shift in our mental model. And this is what we're going to discuss in the next couple of days. So it was actually 1 year ago that the National Academies released a report on taking action against clinician burnout. And the report set the stage for a systems approach to clinician well-being. And you can see on the top left of the slide the conceptual framework that is actually that systems approach, that shift in the mental model that we're going to talk about. There are three messages that I would like to share with you today. First is that we really need to address the main contributing factors of clinician burnout and well-being. That is the demands and the resources and the imbalance between demands and resources that are really anchored in our system, the way healthcare is organized and the way patient care is provided. Number two, those demands and resources that clinicians are exposed to and experience are really designed in the fabric of systems at multiple levels. And they are very much related to decisions that people at these multiple levels actually make. And so we're going to look at how those decisions are made and how we can make better decisions to support clinicians. With the COVID pandemic, we have seen healthcare professionals really suffer from the stress of dealing with a healthcare system that was not prepared. We need to take action. And as the family of Dr. Lorna Breen reminds us and really encourages us and pleads with us, we need to take action. And our healthcare leaders need to step up. So that's the third message. So clinician burnout is really an individual experience with emotional, physical, and behavioral consequences for the clinicians, as well as negative impact on patients and other stakeholders. And so we've seen many initiatives that target the individual mediating factors, and that is where the burnout occurs. That's the individual level. However, these individual level solutions, if they are not anchored within organizational structure and don't have the right processes and support, and if clinicians keep going back to the same work environment with high demands and insufficient resources, then burnout is still going to occur, and we're still going to see negative consequences for clinicians, patients, healthcare organizations, and the rest of society. So we really need to treat the causes of burnout, not just the symptoms. And so let's look more closely at those work system factors. As you can see on that slide, there is a very long list of job demands and job resources, and it's the imbalance of these demands and resources that produces burnout, and this is when well-being is affected. That list is a list that we came up with based on our review of the empirical evidence on the factors that contribute to clinician burnout. So you look at that list and you may say, well, just tell me which of these factors are the most important one. Just tell me what I need to focus on, and then I'm done. Well, I just cannot do that. We cannot do that. It depends. It depends on the specific group, specific profession, context, situation. Therefore, there is not one best way of reducing burnout and improving clinician well-being. I mean, if there was, we would actually know about it and we would have done it already. So you can actually look at that list and think about it as a checklist or as a reminder of the many different sources of burnout, and really think about what's relevant to you and your organization. And actually, this discovery process of figuring out what is relevant to you and your organization is really important. Then you can address the factors that are relevant. On March 23rd, a friend of mine sent me an email, and he said, Pascale, you know, in my hospital, I don't think that burnout has increased very much. People were pulling together. They felt purpose in their work. And actually, early in the pandemic, many clinicians talked about that renewed purpose and meaning of caring for sick patients. And we actually know that meaning and purpose in work is a factor that actually reduces burnout. Well, that email from my friend actually arrived more than 6 months ago. And so since then, a lot has changed. We have seen many instances of high demands and insufficient resources during the pandemic. High demands in terms of long hours and lack of PPEs or PPEs that are not accessible, not available, that are not usable, that don't fit, that hurt the face of clinicians. This is just not acceptable. We got to figure out how to design better technologies, including PPEs. But, you know, clinicians are very creative and very adaptive. So they come up with all kinds of solutions for adapting their equipment, for instance, their PPE, as well as their physical environment in order to perform their job safely. And that picture on the right side actually shows you how infusion pump has been moved out of the room, of the patient room, so that clinicians can better monitor patients while they are limiting their number of entries in the room and therefore reducing the number of PPEs that they use. But as you can imagine, that solution may actually have a negative effect because it reduces interaction with patients. Clinicians have also figured out solutions for improving communication, to know who's who, especially when they have to wear additional equipment while caring for patients. We have also seen instances where clinicians experience moral distress as they have to make difficult decisions about treating patients with COVID or with suspected COVID. And all of these high job demands often come with insufficient resources, such as challenges in teamwork and in communication, and increasingly important issues at the interface between the personal environment and the work environment. And actually, this picture shows you a setup of a clinician who, when they go home, this is actually their hallway, they set up a whole organization of triage of clothing and shoes and decontamination so that they can protect their family. So long hours, insufficient, help insufficient, supplies not enough bed, and the list goes on and on about high job demands and insufficient resources. And so that imbalance is really something that we knew existed before COVID, that became even more important and is still very important today. So we need to figure out how to address that imbalance between job demands and resources. And it's really an issue of designing a better system. And so as we move in that conceptual framework from the right side to the left side, then we really need to pay attention to what happens in those three concentric circles at the frontline care delivery level, among our healthcare organizations, and then in the external environment. In this virtual meeting, we are going to hear about many layers of the system, including the external environment and factors in that environment that can increase burnout, such as systemic racism, social injustice, and health disparities. We are also going to hear about national actions that go in the other direction of reducing burnout by addressing some of the factors that we just talked about. So let's look at those three concentric circles a little bit. At all of these different levels, decisions are made, and those decisions are really what affect those work system factors, the demands and the resources that I was talking about. It's really important to understand that those three levels are not independent. They interact with each other. So for instance, during the pandemic, we have seen rapid changes in regulations and rules, so that's the external environment, which have removed some of the administrative burden exposed by clinicians. And remember, administrative burden was actually one of the work system factors that contribute to burnout. Healthcare organizations have also shown their capacity to adapt their structure and organization in order to deal with the pandemic. For instance, setup of incident command centers. But how do these new structures actually integrate the issue of clinician well-being? And so we're going to hear from healthcare leaders about their approach to this. In the rest of my presentation, I'm going to be focusing on the level of healthcare organizations and what healthcare organizations can do to really take action against clinician burnout. So we have proposed an approach that has three components. And the foundation are the values, leadership, and systems approach. The second component is, well, what is it about the system that we need to redesign? And the third component is, how do we go about it, about change and change management and implementation. So let's look at each of these three components. Values are critical. This is what drives action and decisions. Respect, justice, compassion, and diversity are key values to really address clinician burnout. We need to protect our workers, and we need to allow them to do their job safely, effectively, and efficiently. And so the ability of leaders to express compassion as well as other values during those difficult times is really something that can help reduce burnout among healthcare workers. Leadership is critical. Leadership at the top level of healthcare organizations, as well as leadership throughout the multiple levels of healthcare organizations. And statements by the leaders are important because, they are a way of communicating values and priorities. But a statement without action and without significant efforts to reduce the underlying causes of clinician burnout is not only not effective, it can actually undermine the trust that clinicians have in their organization. And the conceptual framework that I've been talking about really emphasizes those work system factors that contribute to burnout, that imbalance between job demands and job resources. So this is actually the topic of the second component of the approach of work system redesign. If you look at the inner circle, you're going to see the elements of the system. So the system includes care team members that perform activities, and they do that using multiple tools and technologies. They do that in a physical environment and under local organizational conditions. So work system redesign actually means looking at all of the elements of these systems and doing something about it. So that list is just some examples of what can be done to redesign elements of the system, providing better equipment, PPEs that are accessible, usable, that fit. I know how to dispose of them. In the COVID pandemic, we've seen activities that have actually become very risky activities, such as intubation. So what is it that the system does to help the safe performance of those activities? Are clinicians trained? Do they have the tools and technologies? Is the physical environment such that there is no interruption when they're performing those activities? In the COVID pandemic, we've also seen a range of new activities emerge, collecting specimens, decontamination, and communication with families. So again, what are we doing with the rest of the system to train, to prepare clinicians, to help them have the right tools and technologies, the right physical environment, the right team organizations? What is it that is set up in terms of support, peer support, or what is it that the organization provide in terms of support? For instance, policies that address that work-life balance that I was talking about earlier. Early on in the pandemic, I heard from many of my clinician colleagues and friends, sometimes I'm just getting way too much information. I get all kinds of emails multiple times a day, and that experience of overload of communication was actually sometimes right next to a situation of underload or not having enough information. So organizations need to figure out how to manage that balance and provide the right information when clinicians need it. So work system redesign is really tackling all of these different elements of the system. And then there are good design principles. I mean, those are very well documented in the literature, and those design principles include meaning in the job, in the activities that clinicians do, providing job control to clinicians, having a workload that's balanced, not too much, not too little, figuring out how do we use teams, optimizing roles, optimizing distribution of tasks within the team. That's another also important design principle. And of course, providing adequate resources. The third component of the approach that we're recommending healthcare organizations take has to do with the how, implementation. And improving clinician well-being means there has to be an infrastructure and organization. We're going to hear from several chief wellness officers, and they're going to tell us about their job, what they do, and how their job, their responsibilities, and their activities have changed over the course of the pandemic. Figuring out how do we also ensure an organizational culture that fosters interprofessional collaboration. You know, burnout is not just physicians or not just nurses or any one group of clinicians. It's really something that is a shared experience across many groups of clinicians. So that interprofessional collaboration is also something we're going to be talking about in the next couple of days. A big part of the organizational culture is psychological safety, helping our clinicians feel safe to share their emotional issues and to show their vulnerabilities without fearing negative consequences for themselves and their professional career. Improving clinician well-being is tough. I mean, it takes commitment, it takes resources, and organizations are going to implement things. They're going to see what works. They're going to want to keep those things and share those strategies. But there are things that are not going to work, and so you're going to want to get rid of them. And it's really a long road where there have to be processes for learning and for continuous improvement. And the last piece that I really wanted to talk about is participation. Participation of clinicians in clinician well-being improvement. You know, in the discipline of patient-centered care and shared decision-making, there is that motto, nothing about me without me. Well, I think that same motto applies to clinicians. Clinicians need to be able to participate and, you know, not lip service involvement, but real, genuine participation. And there are many tools and methods of human-centered design that can be used for that. But we also need to figure out how to do it in a way that doesn't add to their load or to their burden. And so this is one factor that hopefully we're going to be able to talk about in the next session. So all of these are pieces of a puzzle for a road that we need to engage in, or we need to pursue if we're already engaged in that road. There are going to be twists and turns, there are going to be bumps, and it's just a road that we have no choice. We need to get going on or continue on that road in order to reduce clinician burnout and improve well-being. And remember, the title of my presentation was Systems Approach to Clinician Well-Being, a Shift in Our Mental Model. And so mental models are how we represent the world in our minds. And the reality of healthcare is complex. Dealing with clinician well-being is tough, it's complex. Hopefully I have planted enough seeds to change our collective mental models and our individual mental models so that we can further improve clinician well-being. And isn't doing the same thing over and over the definition of insanity? So can we just team up and work together to develop and implement that systems approach to clinician well-being? After all, we need to do everything we can to allow clinicians to do their job and provide high-quality safe care. So thank you very much for your attention. We're now going to move on to session 2.